Welcome back to my mental health and crime channel. My name is Huda London. I'm a licensed cognitive behavior therapist and I'm a licensed mental health counselor. Please like, share, and subscribe if you enjoy the contents in this channel. I would like to start by thanking all my subscribers for all their warm wishes, their kindful and mindful comments that they leave in the channel. I would love to thank each and every subscriber of mine. I want to wish you all a lovely weekend and a lovely holiday season coming up for most of y'all. Today, I would like to talk about an important mental health subject. It is a mental health diagnosis called bipolar. Bipolar is a mental health disorder that is usually diagnosed under the DSM-5. There's three kinds of bipolar disorders. Most of them have something similar in them, that is the highs and the lows. We have the major depressive disorder, that's when it goes to the low, and then we have the manic episodes of the manic moods and the behavior that contribute to this mental illness. Let me start by talking about bipolar 1, which is more a severe mental health disorder than bipolar 2. The difference between bipolar 1 and 2 is when it's bipolar 1, the manic side, like I'm talking about, high energetic, overly happy, overly optimistic, euphoric, high self-esteem, grandiose, such kind of behavior, people may think that it's positive. But it is not positive when it goes for such a long time, because some of the people on bipolar 1 need to be even hospitalized, put in a psychiatrist treatment center or hospital when they are facing the manic episodes. When it's bipolar 1, that could go up to 7 days to 10 days, but they usually say 7 days, that the person feels energetic, overly happy, optimistic, grandiose, very high self-esteem. They believe that they can do everything. Sometimes they feel like they have a mission sent by God. Like some of them could believe that they have supernatural powers and that they're sent to do something that a normal person wouldn't have been sent to have been done. So it's a really high self-esteem. But then on that's the manic side, and when it goes to the low side, they have major depressive disorders, like a deep depression, and that's the time they feel hopeless, discouraged, they have lack of energy, they may hardly get any sleep, or they may oversleep, sleep too much. It's mostly in their physical symptoms. The mental symptoms leads them into a deep depression where they feel hopeless, low self-esteem, they isolate themselves too much. It just takes them the opposite of the manic episodes. Then you have bipolar 2, which is almost similar, but it is more of the timing that we focus on as mental health counselors. Bipolar 1, they would have the manic side for 7 days, and then they would have the major depressive disorder sides for 2 weeks or more. But in bipolar 2, the manic disorder sides, or the manic episodes of like feeling high energetic, the things that like I mentioned, overly happy, optimistic, grandiose, euphoric, high self-esteem, all those things would last for 4 days. Bipolar 1 is 7 days, bipolar 2 is 4 days. That's how we know the difference. So it's like to follow many of those symptoms and to see how the person behaves, how long the manic episodes last. Most of the people who have bipolar are under medication and are supposed to be under regular therapy. Some of them go to cognitive behavior therapy, some of them go to psychodynamic therapy. It is a mental health disorder that changes a person's life totally. But with therapy and with, sorry guys, sorry, I'm getting this allergic reactions these days. But I wanted to say, coming back to that, with the mental health disorders of bipolar, I've noticed that people use the word bipolar very lightly. Even the words like antisocial personality disorder, the word we don't use in mental health, which is kind of discrimination, is a psychopath. We don't use those terms lightly because a psychopath proper term is antisocial personality disorder. Many people say that, oh yeah, I feel that person has bipolar and all. We may think of it and say, oh, some people in our family do have bipolar, but it doesn't necessarily mean that. There has to be more than 4 or 5 of those symptoms present for someone to be diagnosed as bipolar. A lot of psychiatrist evaluation goes into it, and in therapy we do a lot of health assessments before that conclusion is made. It is sadly a mental health disorder that can come from genetic, it can come from the environment, and it can come from drug disorders like people abusing, drug addiction and alcohol addiction. So all those things can lead to bipolar and other severe mental health illness. People that have bipolar usually are under medication and therapy, like I've said before. So there's a lot of change that they go through. They suffer physically, mentally, emotionally, and it's really sad. But the good thing is there are so many therapies available these days that the general practitioner can recommend, and there is so much therapies that a psychiatrist can refer them to. So when they come to therapy, we deal mostly with their anxiety and their depression levels. We try, that's why cognitive behavior therapy is quite positive for such kind of mental health illness like bipolar. We deal with them a lot, and it's like sometimes people misunderstand when they hear that people with bipolar suffer to manic episodes and have manic, they can be in a manic stage, like energetic and over optimistic, overly happy, high self-esteem. Some people may say, but actually that is positive. No, it is not, because in everyone's life there is periods that we do go into a depression, and there are periods that we feel maybe just happy for no reason at times. But when the happiness goes on I'm talking about 7 to 10 days straight, or for 4 days in bipolar 2, then that can be a bit abnormal to say that. That is when you need to seek attention, I mean, from a psychiatrist and from therapy, mental health counseling. So, I believe there are so many people that suffer through bipolar, other personality disorders, like borderline personality disorder, bipolar, antisocial personality disorder, historical personality disorder, many more. It's because I believe that many people are kind of in a denial. This is something I personally have noticed, that many people are in denial that they suffer from something, and some of them are too proud to seek help, or they don't want to be labeled with these disorders. But what is important for them to understand, if somebody thinks that they have a loved one who's suffering from it, or they believe they themselves are suffering from it, it's always wise to seek therapy so that you have a healthier life moving on, have a healthier relationship, because nobody deserves to suffer in silence. And medications are important when somebody has bipolar, because I can give you many case examples that when a person who has mental health illness like bipolar or schizophrenia is not under medication or monitoring. I'll give you a good example. We remember the case of Cash Gernon, the 4-year-old boy who was killed from Monica Shivada's house, that his father Travis Gernon left him and his twin brother Carter with Monica and just left. He was on drugs and such things. But do you remember that Darlene Brown, the 18-year-old boy who many of us believe that Cameron was involved too, but Darlene Brown suffers of bipolar and schizophrenia, you see? So when somebody doesn't take their regular medications, doesn't go to therapy, it can lead to psychosis. That's what happened to him when he was doing that to the little boy. Then we have another good example, a case that I've discussed about on my mental health channel, not for a very long time. Many people actually had a lot of comments, put in a lot of comments about that case. It was Beatrice Bijot, the woman who drove, the lawyer, the real estate attorney, who drove into a crowd of people. Luckily, nobody died, but many people got injured. And I remember many people leaving it in the comments saying that she's a lawyer, so she knows the law and she's using the law to her best advantage to get away. But what people sadly don't understand is I don't believe that was the case at all. Beatrice Bijot was actually put into a psychiatrist's ward 4 or 5 times of her life in Texas and in Florida. We remember the law enforcement officer, when he comes back with the report, he mentions that himself. So I don't think law enforcement have any reason to lie for a suspect or for someone who's done such damaging things to innocent victims. Beatrice is a very good example because she stopped taking her medication. She did not see her psychiatrist. She did not go to therapy since 2019, and this happened in February 2022. So during the time of, she said the last time she went to a psychiatrist was in November 2019. So you can imagine a year and a half went by, a year and 4 months before this horrible incident happened that she drove into people. She said herself that she was hearing voices She said that she has bipolar, and I believe she has schizophrenia too because she was hearing voices, the delusion side of her, and the hallucination and everything was contributing to her mental health illness. So, what I'm trying to say in this case is there are many cases that we see people suffering of bipolar, schizophrenia, other mental health disorders, and when they do not get the right diagnosis and do not get the right form of therapy and do not stick with their therapy, then things are bound to go in a horrible direction, which is dangerous for society, dangerous for innocent victims, and dangerous for the person themselves. Everyone in life wants their loved ones and themselves to get treatment if they are bipolar or other mental health illness. I've always said that, and I've always insisted that so many times. People should understand that physical health illness are easier to see. God forbid, if you get a cyst and you start wondering if it's cancer or something like that, the automatic thing is you see it popping out, so you go and get physical help. But when you don't see something like bipolar or schizophrenia, like mental health illness, then you may think that it's just, or these symptoms can be ignored easily. What people don't understand is mental health illness is really important to get in check and to get in order and monitor it in the early stages because it's part of your brain structure. It is very important, otherwise, it ends up changing your thoughts, your feelings, and your behavior, which can be a danger for yourself or danger for your loved ones or danger for your communities. Many of these mental health illness, when we say that it can come from, if it's not genetic, it can come from environment. Environment means like, say somebody who's grown up in abuse, trauma, drug addiction, alcohol addictions, and such things. You see lately for the last 20, 30 years, I personally would say that there's a lot of cases of mental health illness, and that is because of so much hidden tragedies at home. So it is important that we take care of our mental health, take care of our physical health, take care of our loved ones, because you only have one life. It's important to take care of it. If you see for some reason that your depression has gone into a long period like 2 weeks and it keeps on happening, and then you're manic at one time for 7 days or 4 days, get yourself checked up. There's nothing wrong. It shouldn't be a stigma anymore. Mental health is important, and we're here to help as counselors, I'm sure, and I know psychiatrists are here to help. It is our duty to get a better mental health society, which is important. Guys, look after yourself. Drink plenty of water. Look after your mental health. Look after your physical health. Look after your loved ones. Look after people you care about. The sad thing is, many people don't understand how important mental health is till we hear that somebody has committed suicide. And then we start wondering and we ask ourselves, but why? He looked happy to me or she looked happy to me. I didn't see any signs of that before. But that sad thing is, people who usually suffer of depression, anxiety, and other mental health illness, many of them keep it to themselves. So check on your loved ones. Because sometimes victims of suicide or attempted suicide always think, do not burden my loved ones, do not burden society. And that would be wrong. So we need to always look after ourselves, look after loved ones, Pay attention to the environment around us. Pay attention to the community around us, our own communities, and help people who are suffering. Just by giving a smile to people can sometimes help them from doing something that can cost them their life or can cost other people their life. Check on your loved ones, check on yourselves. Do a mental health check for yourself. There's nothing wrong in that. Try not to get burnouts at work or whatever you're doing, because that can lead to depression, anxiety, etc. Have a lovely weekend, guys. Stay blessed. Bye. Please remember to like, share, and subscribe.